finally. Everything is working for me, finally. Finally, cause I got the favor of God over me, over me. Everything is working for me, finally. Finally, cause I got the favor of God over me, over me. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. If I say I have to calculate to you or speculate to you, His promises don't fluctuate to you or palpitate to you. His blessings just be flowing out, down on me. His favor just be flowing out, down on me. No need.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts. Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
A wonderful evening to all, and thank you once again for joining us for another edition of the Health Talks. Today we have a very interesting show lined up. We'll be speaking to Ghana National Council President, Mr. Kwasi, and we'll be issues that are arising in Ghana. Please take this time to share this feed, invite your family and friends, and we'll be right back. Thank you once again for tuning in.
Where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
Are you sick or have a health emergency? and don't want to wait in long queues at a hospital, especially during these times of COVID-19. Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for tuning in. The challenges faced by Ghana's healthcare system include poor hygiene and sanitation, inadequate financial health investments or limited workforce and facilities. Among other African countries, Ghana does stand out for its high rates in health insurance coverage. About 40% of the population has policies available through the National Health Insurance Scheme. But this particular program ended up costing the government much more than they expected. A proposed cost-saving policy called capitalization would be paying payers per patient rather than paying for service provided. This policy looked very good on paper. However, it failed in a pilot program that they tried in Ghana. Tonight, my guest is Mr. Kwasi Sam. He is the president of the Ghana National Council of Metropolitan Chicago. In 2008, he joined the Ekwapiman organization, which is an affiliate of GNC, and he served as president for 10 years. During his time as president, he was appointed to be the representative to the Ghana National Council, where he then served as business manager for 2 years and then vice president for 3 years. In December 2016, after serving the community, he was voted to become president of Ghana National Council and is currently serving his second term as GNC president. He continues to play an active role in the community. He is a loyal patron of the GPNA, and he is focused on uniting and promoting excellence of Ghanaians in the African diaspora. Good evening, Mr. President. We're so happy to have you here today. How are you?
Good evening. I am good. Thanks for having me today.
You're more than welcome. So viewers, we're going to get started. For those of you who are not familiar with Ghana National Council, we're going to start off by learning a little bit about his position in the council and what his goals and aspirations are for the community. So, Mr. President, tell us a little bit about your role as president of the Ghana National Council.
Well, let me just start by saying I know today is our brothers and sisters in the Muslim community. Today is their festivities going on. So we want to wish them well and pray that Allah continue to bless them in the days and the years ahead. Here at the Ghana National Council in Metropolitan Chicago, it is a community organization that brings all the Ghanaians in the Chicagoland area together. All the ethnic organizations, we all come together to form the Ghana National Council. So what we pretty much do at the Ghana National Council is work more towards bringing the community together, helping the community, the elderly, in terms of students, healthcare, all the aspects that, one that came from Ghana and living in Chicago, the kind of help that they would need to survive is what we do. So, and then we are known for one of the biggest, United States and all across the world, which is called the Ghana Fest. And so the Ghana National Council pretty much try to foster, culture, because we are far away from Ghana. We make sure that, we hold on to our culture and traditions from back home. So Ghana National Council is pretty known for, bringing the community together and hosting Ghana Fest, which brings a lot of people, between 5,000 to 10,000 every year together here in Chicago.
Great. And tell us a little bit about how Ghana National Council responded through the pandemic. when COVID-19 was first announced, what are some of the things that you implemented with your administration to support the Ghanaian community during the pandemic?
Well, we started off by we have a couple of health experts in our organization, so they helped us pretty much to educate the Ghanaian community as to what is going on. I know we did some donations of masks to the children's hospitals here in Chicago, but we pretty much what we did most was since the pandemic, the elderly was was vulnerable to the coronavirus. The Ghana National Council embarked on house-to-house visits to supply most of the elderly and the vulnerable some essential, amenities, to get them to survive, a month or two. So that's what the Ghana National Council did to help. I mean, we couldn't help the whole Ghanaian communities, a lot of us here, but we're able to pick out all the elderly and the vulnerable and did our best to, go door to door, house to house to, give them some stuff, which was very appreciative by the community anyway.
Yes, it was. It was a very good outreach. So by this being your second term, what are some of the things that you plan to achieve in this term as we're in the second term of your administration?
Well, coronavirus, first of all, let me start by saying coronavirus has actually given us, something to think about. And we've realized that there are a lot of elderly and undocumented people in the community. And then as large as we are, we kind of thought of the need to have a Ghanaian community clinic. And so it is something that we are seriously thinking about. Unfortunately, Corona has slowed us down a little bit. So hopefully the city is opening up. And once the city opens up, that's one of the things that we'll want to achieve, to have a community clinic in the city of Chicago. Also, we've been embarking on a project called the Ghana House Project. And due to the Corona, it has slowed us down a little bit. But plans and meetings are underway to make sure that right as soon as the city opens up, we're going to continue where we left off, and then we're going to make sure that at least by the time our term is over, we should be breaking ground trying to get this Ghana House going. So pretty much those are our major two things that we want to achieve. Other than that, we still continue to bring the community together. We still try our best, to make sure that we are all educated in terms of, the protocols and all that. But then, thank God, the city is going to be opening up, so it will make it easier for us to, embark on a few of the projects that we've been trying to do. I know we used to do, a health fair and back to school programs for the children, the youth festival and all that. We haven't been able to do them due to the Corona. So hopefully, when the city opens up, we'll be able to do a few of these things, to get the community, going.
Absolutely. And so you mentioned the community health clinic, which is a great initiative that's going to be able to help our community. Tell us a little bit about what the Ghana House is going to represent and how it's going to help the community at large.
Well, the Ghana House is pretty much going to be a home of all Ghanaians in the Chicagoland area. So as you are aware, we have children that are always ready to learn, the culture. I mean, children that were born here want to learn the culture, of Ghana. And a Ghana House will pretty much give us the space, to accommodate all the youth who wants to, champion on the culture and tradition, from Ghana. Also, as you are aware, we do a lot of events, be it outdoor, weddings and all that stuff. This will be a home for all events, in the Ghanaian community. Also, what we are hoping for is that if we are able to get a larger space, we'll add some Ghanaian commercial outlets, be it restaurants, African markets, barber shops, a few other things. We are hoping to get a bank inside, and we are hoping to, include a few other essential, items that are needed in the community. So it will be one big house where a lot of things. Pretty much if you go there, everything Ghanaian should be there. That is our main goal.
That sounds exciting, and we are really looking forward to seeing that in the Chicagoland area. So, Mr. President, as the leader, what are some of the challenges that you have seen amongst the Ghanaian people right now with the pandemic, and then just in general, like what are some of the things that Ghanaians in Chicago are kind of dealing with?
Well, that's a tough one, but as Ghanaians, usually our challenges are, number one, I would say funding. It's really tough to get funding to do some of the things that we do. For example, trying to get a Ghana house, it costs like almost $10 million, and you know how hard it is to find money. But we are not giving up. We're still doing our best. But the challenges here and there, sometimes my personal experience, in the administration, we get a lot of sometimes some opposition, which some of them are good, some of them are not. We the good ones help us to, straighten ourselves to do things the right way. But there are some bad ones too that is not a lot you can do about it. When you're trying to move up, others who are not in that zone are also trying to draw you back. It makes it a little harder, because you always keep going back and forth, up and down, and that makes it a little harder. But, as president, my predecessors have tried some of these things. It never worked, but are we going to give up? Maybe not. So we are also continuing from where they left off, and we are not giving up. We are trying to get an embassy here in Chicago to be able to process passports, visas, and all that is still in progress. It's been a little tough, but we are still working on it. Hopefully we can get things done. Chicago is pretty much in the Midwest, and if we're able to organize all these things, we will attract a lot of, people from around us, to patronize the things that we do. So it is something that we can't give up, something that we want to, try. Despite the challenges, we still continue to move ahead and see what we can get.
Yes. And Mr. President, we know that you are always very concerned with the public's health. So a lot of people are asking about what our plans are for Ghana Fest. What do you have to tell people about who are looking forward to seeing us in the park as we always are, and doing all the chiefs and everything? What do you have to tell them, even though we are still in the pandemic and they are telling us that, the city will be opening, but, as the leader of the Ghana National Council, what would you say to all of that?
Well, that is something that I actually had a meeting with my executives yesterday, and we had to, do some planning. But at the moment, Ghana Fest, as you know, is a very big one, and the planning usually starts right from the January 1st of the year. And we are already in May, and we just got the announcement from the city that the city is opening up in July. It's a little bit too late to plan, the actual Ghana Fest that we usually do. But, the executives are still working hard to see what we can do in place of the huge one that we do. So as at now, our focus was actually on the virtual Ghana Fest that we did successfully last year. And that is what we intend doing this year. But we're still going to go back to the drawing board and see if there's anything we can do, to make up for, the huge Ghana Fest that we are doing. It's unfortunate, but it is too late for us to, organize the bigger one. Hopefully next year we'll get the big one. But we haven't given up. We're still working and seeing if there's a way we can do something to at least engage in the community. We know that COVID is kind of slowing down, and the president actually today was saying that, people that have taken their shots can go out freely without a mask, but we don't know how long that will last, and we can't be sure if every single person has also taken their vaccinations. So it makes it a little harder to make a decision as to going into anything outside in full force. We'll have to wait a little bit and see. But definitely by July, by the season of Ghana Fest, we'll definitely have something for the community.
Yes. And speaking of vaccinations, I know that you came out with a publication encouraging the community to get their vaccines. What is your stand on vaccines? Have you also been vaccinated?
Yes, first of all, I've been vaccinated. You know, my family has, and I mean, a lot of people that I know, you know, personal conversations. We've tried to encourage people to go on the community website and on the community WhatsApp page. You know, we've been trying to send information in terms of the vaccination centers to people. And I personally get a lot of calls when people need directions to go to, you know, each of these places. So it's been encouraging. However, we still cannot be assured that everybody has taken, you know, their shots. So we still, you know, we continue to educate the people, you know, they need to get the vaccinations. And we are hoping that, you know, with the new directives that is about to come out, people will take advantage of that and make sure that they get vaccinated.
Absolutely. Viewers, we've been speaking to Mr. Kwasi Sam, who is the president of the Ghana National Council. Stay tuned and we'll be right back. Thank you for tuning in.
The Postage Mix class is something the industry needs, because I have been part of so many conversations where the argument has been that songs coming from outside Ghana, let me not even go far, especially our Nigerian counterparts. So many people feel that their songs are well produced, well mixed and mastered than the songs we produce here in Ghana. I've had countless conversations with Postage himself. So when I heard that he's doing the Postage Mix class, I said, okay, every producer needs this. So growing up, I was told that knowledge is wealth. So whatever you do, seek knowledge. My name is Sammy Flex. I work with Xylophone FM 102.1, and also I operate an online channel, Sammy Flex TV. I endorse Postage's Mix class. Everyone should be part of this.
Good afternoon, Yamime. Achomi Nila Telai, aka Sterling. Yefane, meantime I'm trying to adafifio COVID neba ne, elako ni eba egbemewa. Ewo face mask na ke wo sani wo shi wana ake owo face mask ke chefio egbla otue ehan otue se shambo. Ewo ehan ni mepi anya wo keche na mejio shi wo ke no kombajara na emi. Ni wo ba ho anye ne ba anye han owo face mask ke de lebi ka shi gbeke na eche yo tue ewo ni ene hu ake wo tue se ake mo kon se oku ese ne ba kan ne ke face mask ba blale ne ba mo miabo no ba nyo wo le lebi ka shi gbeke no jie ni onye una ila na eko ewo ene ni wo ke mbajara na emi na ele wo ba ho anye ko ta wholesale price alo ba fan no ya ho wo ye habo ko ta no ba ji oba hele 11 wo ye habo wo number ni obanyo na wo ye no ne 0244 255 193 ko twawo efe no yo obanyo wo ke ba no ba ho habo no wo fe wo ya jowo because ila gbonyo ni neba eba gbe wo san wo fe wo fo wo ya fa ba no onye you are don ketuebo.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back to the Health Talks. So we've been speaking to Mr. Kwasi Sam, who is the president of the Ghana National Council. We've been learning a little bit about Ghana National Council and what their plans are for the upcoming term. We're going to switch gears a little bit, and we're going to speak about Ghana and healthcare system. So, Mr. President, we'd like to speak to you about your own personal experience that you had in Ghana in terms of healthcare. It started at Just TV and on Mama TV. Thank you all for your support. So, Mr. President, do you think that healthcare in Ghana is both accessible and affordable?
Well, that is an interesting question. Accessible, I would say yes, as compared to 25 years ago when I left Ghana.
Okay.
Affordable, I would say no. In Ghana, and we all know the system in Ghana, it is definitely most of these health centers are usually cash and carry system. So the hospitals, the private clinics, and everything may be there, but the fact is, it's only the people that can afford that can go to these hospitals. As compared to United States and a few other foreign countries, you go to the hospital and you are just being seen, and then everything else will be taken care of later on, right? But here in Ghana, you definitely have to show some cash before you even get to see a doctor. I would say that the less privileged in Ghana are the sufferers of the healthcare system, because even if you get knocked down by a car and an ambulance have to pick you up, the first thing you have to do is to sign some documents and make a payment even before they take you to the hospital. Maybe if you're not lucky, by the time you go through all these things, what will happen to you before you even get to the hospital? It is a challenge. I only speak for what I see. I'm not in Ghana throughout the year, so there are some of these things I cannot speak to. But what I see is that the system works very well for people who can afford, good doctors and good private clinics. But the ordinary Ghanaian, hospitals are not that affordable, and go to the government hospital and everybody is there. So how you even get taken care of is definitely, nothing compared to what we go through here. So I would say, it's improved the facilities have improved from many years ago, but the affordability, is still haven't improved. And to me, it's quite a concern.
So you mentioned about the private hospitals and clinics. So do you feel that the private hospitals and clinic may be overcharging for services compared to what we experience here? You spoke here and said that how when you go to the hospital here, you're billed and at least they take care of you and stabilize you before they come and get your information and you make payments. There is a cash and carry system. So do you feel that some private sectors are taking advantage of that?
Well, I won't just put the blame on the private. I won't just put a blame directly on the private sectors alone. Even the doctors that are being employed by government, the doctors that work at the government hospitals, you for example, you go to want to do a surgery, for example, and the doctor will tell you, will put you on a list, and it will take you 9 months, before it gets to you for that particular surgery. Who knows how long, whatever is wrong with you, is how you're going to manage for 9 months before the surgery. But before you walk out, this doctor in the government hospital will also give you an option that if you pay me this money, or if you came to my clinic somewhere off property, I'll be able to do it for you in a week or in 2 weeks. And basically, he's talking about some money that you wouldn't have to pay. You won't have to pay at the government hospital, but then when you go to the private clinic, you will have to pay. And it's definitely an overcharge from my perspective, based on the fact that, since it's always a life and death situation, they always give you, some figures that, either you do it and you don't. And I don't know, most Ghanaians here in the United States will probably agree with me that most of the calls that we get from Ghana is usually when people are struggling to get, some medical, help, and they're always calling you in the middle of the night saying that I need to go to the hospital, but I need money. So I would say that, they're definitely overcharging and using all they can to take advantage of the, the less privileged. Yeah.
Yes. And so when you were in Ghana, how comfortable were you with the healthcare that you received there? Could you tell us a little bit about your own personal experience, like with the hospital or the clinic, or any provider, doctor, nurse that you encountered? How comfortable were you with their knowledge, with the way they treated you? Tell us a little bit about that.
Well, I want to speak on record to say that it was very uncomfortable. It was quite an experience, but I would say too that I was fortunate to have known a lot of people who were in the medical field, And so in my case, it wasn't too bad because I had people, or I had doctors who, had influence in the system. I had doctors even here in the United States that were checking on me and making sure that things were done right. But, if I didn't know anybody and, I went just like an ordinary Ghanaian, I would say that the services are definitely nothing to speak well about. And I'll give you some examples. There are some of these hospitals and these even high class clinics. I remember one time when I went to an emergency and I was taken care of overnight. And when I was leaving the hospital, they told me the doctor himself had closed for the day. And so when I was leaving the hospital, there was no documentation. So I didn't even know what my situation was. And when I asked for, some kind of paperwork to show my doctor, they said, well, we don't give out any paperwork, So basically you pay all this money and they won't even tell you, or they won't even give you a copy of, what transpired. Let's say your sugar level was 150 when you walked in. They treated you and now it's 120. For example, they don't have any documentation, So if you go to your primary doctor and you tell him, this is what happened to me when I went to this emergency, you definitely have no knowledge of what happened actually, because, when I specifically called back and they said, oh, we don't give out anything. I said, what do you mean you don't give out anything? They said, well, I have to speak with the doctor and see if we can get you something. So, imagine if I'm an ordinary Ghanaian and I don't have any doctor friends who were requesting to see those documents. Why would I, be, going to them to ask for some paperwork? So basically they will treat you and not tell you exactly, what your conditions are. Just the fact that you are alive and able to walk and be able to get out of the hospital and pay them. That's all they do. And I want to say one thing. I've been to some of these hospitals, spent a few days there, and the only most active department in all these private hospitals and clinics are the cashiers department. They don't play over there. You go there, you have your money, they take it right away. But go to the same hospital, go to the dispensary. The where you pick up your drugs. Go to the laboratory where you do your lab work. Go to where they take your vitals and all that. It's horrible there. So you go and sit there and 10 people will pass by you and keep telling you, oh, somebody will be with you. Somebody will be with you. And honestly, I don't want to compare it to United States, but even in Ghana, it's not acceptable, because you'll be sitting there waiting and somebody will just walk in and will mention some other person's name that, oh, this person asked me to come see you. Guess what? If it's 10 people waiting, they will take care of that person right away because he knew some minister or he knew somebody of importance in Ghana. And even when you have your money, there's not a fair system there. And then the other thing that I noticed, especially when we were in the Corona times, right? The system is different. If you go to any hospital in US, for example, and I'm only using US for example because I live here. And for example, you have Corona, you have COVID, right? First thing they do is make sure that they set you where you won't be accessible to the not just the hospital staff, but even the hospital the visitors at the hospital, right? But in Ghana, I noticed that even the people that has COVID, right? You walk in a major hospital and you tell them you already have COVID, but you are here to do A or B. They will still send you to the cashier's department to make a payment. They will still send you to, and guess what? The cashier's room that you go to wait to pay your bill has about 20 people that are there for other reasons other than COVID, right? And then you'll be exchanging money and you'll be exchanging paperwork with these cashiers. When you need a lab work, even though they know you have COVID, they will still send you personally to go to the lab work, to the lab to do the lab work. Guess what? When the lab results is ready, you still have to walk over to get the lab work and bring it back to the doctor. So even at the hospital, a COVID patient will be interacting with about 10, 15 people before he leaves the hospital. So to me, it even makes the situation worse, so other people may be going to the hospital just to do something with their pregnancy, but they will end up, attracting people that has COVID already, because, there is nothing like people really care too much about COVID. Like in Ghana, COVID is like not a big deal. He has COVID, and so what? I've personally experienced being, in a hospital, or I'll call it a clinic that has been upgraded, to a hospital where it's on record that, you are here for this purpose or that purpose, but there is no, like when you are in Chicago, for example, there is a heart, the heart hospital, the department, right? There is the cardiologist. There's others. But in Ghana, what I noticed that most places that I've been to, everything is together. So whether you are COVID or no COVID, you are with people who are pregnant, you are with people who are there for other reasons. And to me, it would have been nice if they had separated, especially when we're talking about COVID. You're not supposed to be around people who don't have COVID, especially when you've been able to make it to the hospital. So I will pretty much say that, the services there is not convenient. What I see more is that most of these hospitals care more about the money than anything else.
Yeah. A very hard system. So do you think that that gives an increased amount of fear to people? There's a lot of people, even here, right? When we look at different races, it's been proven that, Black people and African people are afraid of hospitals. They're afraid of doctors. Do you think that in Ghana, there is a lack of trust with the healthcare system, just pertaining on even the experience that you gave and everything else that we see on social media of, the poor conditions? Do you think that it makes people reduce trust in the healthcare system in Ghana?
Well, you know what, that is something that I would say yes, because interacting with a lot of people, the fact that you mentioned that you are going to the hospital, 7 out of 10 people will tell you, what are you going to do at the hospital? What is wrong with you? Are you coughing? Are you do you have a sore throat? And the funniest thing that I noticed, and let me just put this across, a lot of people, will go to the hospital, for example, with high blood pressure issues, right? Probably September of 2017 or September of 2018. And the doctor prescribed a certain medications, for that person, for that particular, problem that he went to the hospital with. But guess what? When you tell this person that you're going to the hospital and you tell him, oh, because my high blood pressure is up, all they will do is just send you the prescription copy of what they were given 2 years ago. Say, oh, you don't need to go to the hospital. Take this prescription and go to the pharmacy and get you, some medications. Same thing with COVID and all that. It's a lot of people, especially on the WhatsApp platforms, that were always posting certain prescriptions given to them when they had COVID. So when you tell these people, for example, you have COVID, they say, oh, you don't need to go to the hospital. Just go to the, chemist and then buy these and these and these and this. Literally, they try to talk you out of going to the hospital because they think that one medication that helped them will be the same medication that will help you. So, of course, a lot of people would, talk you out of trying to go to the hospital. And I want to say that there is a hospital, I don't want to mention names, but there is one hospital that I know even before I came to United States, right? And I've always said it based on my family history that everybody that went to that hospital with some kind of serious issues, especially when you go on the weekend, chances are that you will die. And a lot of my family members have died going to the hospital, especially on the weekends, because guess what? It is a community hospital, and you know how there are funerals and weddings and outdoorings during the weekend. Some of these hospitals, don't even have a doctor on duty, during the weekends, because those doctors also have a social life where they have to attend to other events. And if you are not lucky and you are not able to survive that weekend, bad luck. But, it is something that I have continuously seen over the years going back to Ghana. And so there are certain hospitals, people will never advise you to go. And to me, it is disappointing, because with all the resources that we have in Ghana and with all the new things that are being done, with all these huge buildings that are building for the hospitals, I think the service is more important. So Ghana probably, needs to work more on the services part of the healthcare system. Buildings alone don't solve the problem.
Yeah, absolutely. And what you mentioned about the hospital and there not being any doctor, there's also been some research that shows that in Ghana, one doctor is actually responsible for 1,000 people. So the patient to doctor ratio is so humongous that the doctors are just overworked and unfortunately underpaid, and it makes it very difficult. There's no, motivation. There's no incentive to, want to come to work and have to be responsible for 1,000 people. So I can definitely see that being a problem there. One thing I really love about asking you these questions is that we know that you go to Ghana every year, so you're able to see the developments. And I like the fact that you said that over the last 25 years, you have seen things, come a little bit better. But from what you have seen before in the past and where we are right now, should we be further, or do you feel like, it's still a gradual process? Or is it okay for us to say that we are behind when it comes to the healthcare system?
Well, yes. With the experience, I would say that we are still behind. And, I'm one person who hates to compare Ghana and US. But at least when you are back home in Ghana, there are certain things that can be done just with common sense, right? And a sense of fairness. So I would pretty much say that, in Ghana, there are so many things we can improve upon that will make things better for everybody. Guess what? We've been lucky with some of these traditional medicines that work, right? But half of these people who can do that don't have the means to integrate their, whatever they do into a bigger. So Ghana will need to support some of these, herbal doctors and stuff to be able to, Ghana is about 30 million people, not as big as other countries. And for, the hospitals that we have and the many doctors that we have, I think we should be able to improve if, we put a better system in terms of, trying to, use some level of common sense and not, think just about money and helping just those who can. Even with that, you still have people in Ghana that are always flying over just for medical attention, whereas they could have fixed, Ghana's healthcare system better for them to be taken care of instead of paying a lot of money just to fly to US to get medical attention. So I will agree that, yes, there's more work to be done.
And I think that is one of the saddest things, and I always talk to people about that, is that when you travel to Ghana, Ghana is such a beautiful country. You have a wonderful time, but the minute you get sick, you get anxious, you get nervous, and you start thinking of how you can change your ticket to hurry up and come back to the US. And you're absolutely right. There should be better facilities where if you travel and something happens to you, you know that if you go to this particular hospital or any hospital for that matter, that the healthcare system is strong enough to be able to take care of you. So that is a very important point. We're going to take a short break and we're going to read some of the comments that we have. If we can get those pulled up, Mr. Producer. name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us. We'll go ahead and read some of the comments that we have on our feed. This first comment is from Mr. Sam Tuda. He says, exceptionally, excellently, brilliantly project. Thank you, Uncle Tuda. Mr. Steve Day, who is the organizing secretary of the Ghana National Council, gives us a thumbs. Was a huge success, which paved the way for other virtual festivals and conventions around the U.S. Thanks to Mr. Kwasi Sam and his team for a good job. Thank you very much, Mr. Day. He also goes on to say that's so true. In Ghana, if you don't have money, you will die of sickness. No money, no care. We have another comment from Mr. Kevin. He says, wow, love this show, guys. Share, share, share. Please follow his incentive and go ahead and share the feed. Mr. Day comes back to say, great show. Well done, Eunice and Pa. Thank you, Mr. Day. We have another comment from Kwame Kakra Jones Ade, and he says, oh no, I'm sorry, they just show that they are watching us. I apologize. Axe Anthony says, great show, well-needed conversation. We have another comment from Incentia, wonderful and thanks to all. Mr. Day comes back to say, wow, Mr. President, if the healthcare delivery system in Ghana is so deplorable, why do we have health facilities that are not being used and abandoned by the government? Thank you, Mr. Day, for that question. One thing I'd like to just say to all of our viewers is that the Health Talk is not a politically driven program. We are just here trying to share information. And at the end of it all, because we are all Ghanaians and we want to travel to Ghana, we want to make sure that we are safe. So all the things that we are discussing today is not to down anybody or to say that someone is not doing what they need to do. We're just speaking facts, and we are hoping and praying that things will get better so we can all have a better Ghana to live in and be with. And then, you know, our family and friends are there. And President spoke earlier about how you get phone calls and messages from your family members in the middle of the night and they need to go to the hospital. These are all things that are real and things that we all deal with. And that is why we are discussing this today. So we'll continue and go on. Mr. President, there's been a campaign that talks about fix the country. And we noticed on your social media page, you rather wrote fix the system together. So I know that the Fix the Country campaign comprises of a lot of different things. It talks about the roads, it talks about the oil, it talks about price inflation, whole lot of other things. But because this is a health program, we're only focusing on the health aspect of it. So when you say fix it together, what are things that we can do to make sure that the healthcare system in Ghana is better?
Well, yeah, thank you for that question. And yeah, I have to be careful on this one. And like you rightfully said, it is not a political, conversation. But when I said let's fix it together, I've noticed a lot of people some saying fix the country, some saying fix your attitude, some saying fix this. But I just think that the system is, the system that needs a total overhaul, because the government doing it alone probably may not work either, and the people doing it alone will not work. What is the rivalry between the government and the people? The government is for the people, right? So, and pretty much the people are the government. So I just believe that it is a system that needs to be fixed. And when I say the system, in particularly the healthcare system, just like we were talking about, I want to go to the hospital, right? But when I'm first in line, I want to be the first person to be taken care of when the doctor shows up. What is the biggest deal with that? It is part of fixing the system. I want the cash and carry system to be abolished. It is part of the system that is broken. When somebody is unconscious, he can't even reach out to his pocket and get money out to pay the ambulance to take him to the the emergency office, right? So pretty much, the healthcare system needs, a lot of work. It needs to be fixed. If you go to, if you know anybody that knows more about Kolibu Hospital, basically a lot of doctors, and excuse me to say this, a lot of doctors are just there to do their business. You go there, they really don't take good care of people there, but they rather direct you to go to their pharmacies, because almost all these doctors have their private pharmacies around the Kolibu Hospital and a few other places. Most of these doctors have their own private clinics. So, if you go to the hospital thinking that you're going to get the treatment that you deserve, guess what? You'll be wrong, because all these doctors are there for just a few hours, and then they spend a lot of time at their private hospitals. So they will not even spend the time needed at the main hospital, because they have to attend to, their patients. So that system needs to be fixed. I noticed that there are some ambulances that are, being brought into this country, but it's to me, it's still a joke. For a whole constituency to have just one ambulance, it's probably a good start, but it's still a joke. Are we anticipating that there's only one person that can get sick or need immediate attention within an hour? Maybe not. So I think every region or every constituency probably need a minimum of about 5 ambulances to be operating at different times with different people. So I personally think that the system needs to be fixed. And one thing that I noticed when I started going to the hospitals here in America, it's not everything that is done by the government. If you go to the Rush Hospital in Aurora, you will see a list of people that have donated, monies, some $1 million, some $2 million to, build a hospital. But in Ghana, when we talk about hospital, everybody's thinking that the government should build a hospital. There's nothing wrong with a few rich people coming together to say, hey, we live in this community, we were born here, and so we have $5 million to build a hospital for the community. And a lot of hospitals here in United States are built by churches, but I really don't think that I've heard much of all these huge churches in Ghana building a hospital for the community. So when we are hoping for a good system in Ghana, I don't think we can only depend on the government. The government can do all it can, but for how long is it going to take them to do? And when I always compare stuff, I always say that do things that you have seen somebody do it and be successful. Exactly. So if churches and individuals are building hospitals for the community, why can't, there are some rich men in Ghana that are more richer than the people that we call rich men here in America, but what are they doing for their community? I was just talking to a friend the other day, and there are some rich men, even the road going into their house is as bad as you can imagine. But guess what? Because they drive these luxurious 4x4s, they think that whether the road is good or bad, it doesn't affect them, right? But these are the kind of people that can infuse, some help into the system that will make things get better. So the whole system must be fixed. We all need to look at things, a different way. The government definitely needs to do its part, but we, the people too, will have to do our part. And when we all do it together, it makes it, more efficient, more quicker. And at the end of the day, everybody will be happy. But sitting, along the fence and watching somebody to do it, and then wait till the person is able to do it or not before you jump in to also try your best, to me, it doesn't work. Let's come together. Let's just do this for the community. No politics involved. We need to fix our country all together.
Absolutely. And you mentioned that everyone should work together. So when you think about something like sanitation, we know that it's everyone's responsibility to make sure that everything keeps clean. So if you're living in an area in Ghana, it would take the whole community to not litter. It would take everyone not to put things in the gutter. It takes the whole community. So now you mentioned that some of the people who have money, more the wealthier people, the churches, they can all help to kind of build hospitals. But for the average Ghanaian who is probably making somewhat less than $100 a month, maybe, what are some of the things that they can do to help the healthcare system? And it can be something as easy as just, following education, but what are some of the things that just the average person can do? Because people watch this and they say, okay, I don't have the money, I'm just going to sit back. And you mentioned that no one should sit on the fence, which is very important. Ghana is a country for us all. So what can some of the people who don't have the money or anything, what can they do to improve the healthcare in Ghana?
Well, yeah, that is a very sensitive topic to some people, and I can understand why it becomes sensitive because there is a reason why even in America, the president is now fighting for the minimum wage. I think, because when people are less privileged, it's difficult for them to even get the 3 square meals a day for their family. So we can't expect too much from them to help out. But one thing I can also say is that growing up, I've always heard when we say, healthy life begins from, sanitation. Mm-hmm. So even if you are poor or you are less privileged and you can be putting money in the system to build hospitals, at least the least you can do is to keep yourself and your surroundings healthy. Personal hygiene, helps out. I've been in Ghana and I've seen areas where people just, excuse me to say, but people just throw anything anywhere they want because at the end of the day, there is nobody to tell them, hey, you cannot do this. I have physically, seen people, excuse me to say, that ease themselves into like a plastic bag and just throw it on the street or throw it anywhere they want. But does that make us healthy? Because if we keep ourselves healthy, I think it's the number of people that will be needing medical attention on a daily basis will kind of lessen. I'm not an expert. I'm just saying from what we learned when we were kids. So, when everybody is involved, not everybody will have to put money in. Mm-hmm. Some people may have to just find a way to live a healthy life. Others may find a way to, put some money. But I will continue to say that, instead of rich people just showing money, every day. I know people that love cars. I don't have a problem with it. But some people I know have so much money that can help the community in advancing, some of these problems that we have in Ghana. But a lot of rich people that I know in Ghana, except a few that I've heard are doing things. Everybody else is just, moving on with their normal life. And for me, I just think that if we are going to try to make things work, everybody needs to be on board.
Absolutely. Absolutely. We are going to take a short break, and when we come back, we're going to take a short overview of COVID-19. There's been some news that now tell us that children are able to get the vaccination starting at age 12. And we'll give you some tips and some places that you can take your kids to get the COVID vaccine. So stay with us and we'll be right back. Thank you.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call Mobile Doctor. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
Welcome to sankofaonline.com. Your #1 diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
My My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back, and thank you, viewers, for staying with us for this very important program. We just want to go ahead and give a quick overview of COVID-19. Remember that COVID-19 is a virus. It's been with us for about almost 2 years, and even though many places are lifting up restrictions, we still need to make sure that we are social distancing, washing our hands with warm water and antibacterial soap. Remember, there are 4 different types of vaccinations. Now, the AstraZeneca one is the one that is available in different countries, so we don't see that here. But we do have the Pfizer, the Moderna, and Johnson & Johnson. Some time ago, they said that Johnson & Johnson was proven to be giving some blood clots, but the CDC and everyone has reviewed it, and I know personally that a lot of my patients have started getting the Johnson & Johnson again, and they've been doing well. Reason why people like the Johnson & Johnson is because it's only 1 shot. Also, the fire department comes out to people's homes. Some of our elderly patients who are not able to go to a clinic and get a 2-shot series, it's just more convenient to get the Johnson & Johnson. Also, remember that Pfizer and Moderna have to be placed in a refrigerator, has to be kept in a certain way, and that is why it's difficult to go out to people's homes and give it. But there, it shows you the signs and symptoms that you may experience after getting the vaccine. It also tells you how long you need to wait while you get the vaccine. So please, I'm just encouraging our community, if you have not gotten vaccinated yet, please go out and get vaccinated. We have many, many places that you can go. If you ever have a question or concern or don't know where to go, you can always send a message to Ghana National Council on our Facebook page or Instagram. You can also send messages to Trend Africa, and we have a vast knowledge of healthcare professionals that will be able to contact you, speak to you if you have any questions or concerns. So there was some messages maybe about 2 weeks ago that talked about double masking. I will say that right now, they have said that there's no reason to double mask, but we also need to just err on the side of caution. We need to do things that make sense. So if you feel like you're going to a place where there's a lot of people who are sick, there's a lot of people who are coughing, and you feel that you may, be exposed to anything, definitely go ahead and wear a double mask. Otherwise, your 1 surgical mask should be fine. If you're wearing a cloth mask, a lot of us had different African fabrics that were made into masks. They're very beautiful, but make sure that you are washing them. You should be washing them with warm water and soap at least once, maybe once every other day, to make sure that you're not carrying any bacteria and just carrying it around. Also, make sure that you are not wearing gloves when you go out to the supermarkets, because if you have any bacteria or anything on your hand, all you're doing is spreading it all over the place. We also know that in Ghana, they received their 2nd batch of vaccinations. So we are praying for the people in Ghana. And some people said that the system in which they were getting the vaccination seemed to be unfair, but we hope that everyone who needs the vaccination will be able to get the vaccination so that everybody who travels there will be more safe. Also, remember that Ghana is still a level 4. However, if you are traveling to Ghana, you need to just go ahead and show that you have a negative COVID testing, which is going to be the PCR. That needs to be 72 hours before you travel. You'll also go ahead and fill out a declaration form. You'll pay to get your test when you reach Ghana, and there's another additional step that they have added just to make sure that they are tracking everything correctly. So we want to make sure that if we do need to travel back home, we are not going to make anybody else sick there. The president spoke earlier about how people in Ghana really don't take COVID-19 very seriously, but I do want to encourage everyone that is watching the show to continue to still wear your mask. They're saying that we shouldn't wear our mask, but I personally would say that we should wear our mask until things have completely gone down. We are still waiting for herd immunity. We are still waiting for a certain percentage of the world to have their vaccinations. And don't forget that India is going through a lot of problems right now. There are thousands of people dying, and so we should take it very seriously because it could be anywhere at any time. On the screen here, it shows through Protect Chicago. It shows where you'd be able to take your children to get the vaccination. There's about 7 places that you can get. I'll post that information here. Again, if you have any questions or concerns, you can always reach out to us and we can help direct you and also help set up an appointment if you need to get a COVID-19 vaccination. Normally, Dr. Afori, who is our pharmacist that always joins our professional panel, comes to speak to us about the vaccines. Unfortunately, he was unable to join us today. So if you have any additional questions, let us know and we'll make sure we get it answered. We'll take a short break, and when we come back, we'll be talking again with the president of Ghana National Council, Mr. Kwasi Sam. Thank you.
Maka maka Royal Black says Diaba Maka maka Entertainment and sports Maka maka I say politics Maka maka Royal Black says Assembly Safwa Bie Assembly Puno Sanepi Adekami Ekome ya kotofumi Ekome ya misegbe You want love fake hanye Maka maka Royal Black says Diaba Maka maka All the trending issues Maka maka I say politics Maka maka Entertainment and sports Maka maka
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
We once again want to thank all the people who stayed tuned. We see everyone who is watching. We really appreciate it. Continue to share the feed. This is a very sensitive topic, but once again, it's something that is very important, very dear to all of us, and that is why we brought it up to discussion. We do have a comment here from Mr. Cromwell. Wonderful show. Well done, Otua and Pakwasi. Thank you, Mr. Cromwell, for that wonderful comment. We also have another comment from Mr. Benjamin. He says, this is a very sensitive topic. I'm happy to hear you talk about it. It's one of the nightmares of everyone living in Ghana and the diaspora. In fact, there's a lot to invest in healthcare system and training of healthcare professionals in Ghana. Thank you, Benjamin, and we agree with you completely. And we just want to bring light to this topic so that all of us who are here, all of us who are in Ghana who have anything to offer to the healthcare system, you know, protesting and everything has its place, but what is more important is to find a good solution to be able to help all. And that is why we are here bringing up this topic today. So we'll continue speaking to the president of the Ghana National Council. He's been giving us a lot of wonderful and very good information of his experiences in Ghana and how he thinks that the healthcare system can change for good. So, Mr. President, when you were recently in Ghana, we know that you traveled to Ghana at a time where COVID-19 was pretty much on the rise and you went to Ghana. So when you went to Ghana, how did you perceive the way people were acting? Were people wearing masks? Were people social distancing? Or was it just, you know, regular, beautiful Ghana?
That's very interesting. But I want to say that as much as we talk about it on the media, when you are on the grounds, it's a little different. And I give you a typical example. When I was going to Ghana and they made all this big deal about you have to fill out a form, you have to pay $150, and you have to do all this to get to the airport. You get to the airport. One of my problems, which I forgot to mention, is that they ask you to fill a particular form online, right? And when we are filling that form online, I may be wrong, but there's nowhere that tells you that you need to print that form and bring it to the airport. It says fill that online. But guess what? When 300 people, you know, come off the airplane, the first point of contact, when all 300 people are trying to come out of the plane, they assemble all of you and ask you for whether you fill out the form online. And if you fill the act online. So that kind of puts everybody together. And when we are in a COVID situation where we are trying to socially, distancing. There we go, where everybody is crowded because you don't have that form. So you have to do it manually, fill out that form at the airport. So I personally think that first and foremost, the hype on media is different from when you get to the airport. Even the government or the airport officials who is supervising this are rather making people kind of assemble at one place, choked with all these fill out the forms and all that. So generally, I'll say that the interactions at the airport, especially with that $150 that you have to pay, trust me, at the airport, and a lot of people who have traveled to Ghana will tell you, at the airport, you have about 4 to 5 different sections that are always making sure that you pay that $150. And I think it's too many people you have to interact with just to get through, at the airport. It's too many people at the time where we are trying to do social distancing and COVID-related protocols. When you get to the airport, I don't know if it's the love of that $150 or whatever it is, but I think the just way they handle things at the airport is not good. My second point is that you go through all this, do your test, you do another COVID test when you get to Ghana. Wear your mask, they make sure you are wearing your mask the right way and everything. But guess what? Once you walk out of the airport and you go to the parking lot and you have all these taxi drivers and people that are picking you up and all that, none of them is wearing a mask. And when you ask them, it's like, oh, in Ghana, the COVID it's not a big deal. It doesn't work. So I'm asking myself, why do you make a big deal about COVID at the airport, on the plane? But then when you get to the airport, even the taxi drivers that are paying dues to work at the airport are not mandated to wear their mask. It doesn't make sense. And then when you go into the city itself and go to events, and I was personally caught in between wearing a mask because I went to a wedding where it was about probably 300 guests. And I walked in there, confidently with my mask. And when I got there, not a single person was wearing a mask. You understand? So, even though we make a lot of noise, we try to educate our people. When you're in Ghana, a lot of people don't believe, in the mask. And they will tell you it's sunny, we are Africans, COVID, has no way of getting us. And I was in Ghana in January where a lot of people died from that COVID wave. So I don't think in Ghana we take COVID that serious. I'll say that. Apart from maybe individual stores, private stores and stuff that they will make sure that you are wearing a mask. There are a lot of places they don't even care, especially with events, funerals, outdoors and stuff. Some people decide to wear it, others don't care. And there's nothing like mandatory, wearing of mask in Ghana as compared to what we see here, So I would say that the individuals don't take it as serious as it should be.
And in general, how do you think that Ghana's response was to the pandemic? There was a lot of talk when, the pandemic started and it was slowly growing in Ghana. They had the year of the return and they, expect a lot of people to travel. And then there was a time when they had the whole shutdown and people were complaining people needed to go to work, the economy. So in general, when we look at, the response to the pandemic, how would you rate that on a scale from 1 to 5? Ghana's response to the pandemic.
Well, Ghana's response to the pandemic itself, based on what I hear, world news and all that, I think they did it pretty well. They did their best. I mean, I've even heard other people that I didn't expect them to say that, the country handled the corona well. But that is where, some of our problems may come from. The government may be doing things right, but when the people are not doing things right, it doesn't give us the best results. For example, we're just talking about it. If the government does its part and the community or the people don't do their part, you don't get the desired results, right? So I would say that based on what I've heard and based on the little things that I saw in Ghana, the system was trying their best to take care of the COVID response, making sure that everywhere you go, be masked up. But we're on the street probably the government can control the street, right?
Right.
Can control individual homes and all that. So I will personally say that the response from Ghana as a country towards, COVID, I'll give it a 4.
Okay.
I'll give it a 4.
Yeah, that's fair to give it a 4. Okay. And
4 out of 5, right? 4 out of 5. Yes.
Yeah. So when you were in Ghana and you look at the TV, so here when we watch TV every morning, we watch the news, we hear COVID updates. They tell us about statistics. They tell us about how to keep ourselves safe. Doctors will come on and explain things. Is that the same way that you saw television in Ghana? Were there enough education outlets through the media, through other sources to educate the people in Ghana about COVID-19?
Well, let me just say this. I know some people wouldn't want to hear this from me, but I personally have an issue with the television system in Ghana.
Okay.
If you flip through a lot of channels in Ghana, even at 6, 7 o'clock in the morning, they are talking about politics. If you're not talking about politics, they are talking about some church online doing some miracles and prayers and all that. There are some other fetish priests have their channels, and then some foreign programs, on Ghana TV. So Ghana television is pretty much flooded with too much politics, too much faith-based programs, and then the least opportunity you have to watch something else, there'll be all these foreign programs, foreign TVs, white people trying to speak Chi and all that. I don't know what it's called, but those updates, are not as, frequent as the ones we have here. I watch CNN here every day, and almost every hour they are talking about COVID. Unlike Ghana, I think the politicians probably support the TV stations more. So there's a lot more politics and faith-based events on TV. So and the average Ghanaian, I won't say the average Ghanaian has a TV at home also. So that information is not spread, to the very bottom, as the community entails. Yeah. So I would say half of the people may receive information as to what is going on with COVID. But I mean, we all know Ghana, it's not the best, but at least, when we have the opportunity to have TV, we should get COVID updates more than it's been. And I don't want to say they haven't never shown COVID, but I'm saying that on a frequent basis, it's just once in a while. Yeah.
Okay. And what about in the open spaces? So here, and not only here, I guess in different countries too, if you think about big areas, marketplaces, grocery stores, right now, if you go to Whole Foods or something, there's information about COVID, right? If you go into the store, there's a thing there that you can grab, like a number if you need to talk to someone about COVID or domestic violence or a variety of issues. So let's look at the market system in Ghana, huge markets. Did you see at any time, or have you heard of any time, someone even using that outlet? Maybe somebody would go there with like a loudspeaker and educate people, or kind of just walk around and tell people about, good sanitation and how to prevent getting COVID-19. Did you see any of those outreaches being done when you were there, or have you heard anyone tell you about those?
Well, I can't lie. I did not, and I will tell you, in confidence that there was even this church that I went to, and as obedient as I was with protocol, I was wearing my mask, and I remember the pastor telling me, "Take off your mask so I can see your face." It's just unfortunate that I was just talking to a friend of mine a few days ago, and I learned that pastor just died a few weeks ago of COVID. So a lot of Ghanaians are no respecters of, the COVID-19. And, as much as people are doing their best, I mean, I have a doctor friend, who every time she's talking to me, she'll be like, "Do you have your mask? Are you wearing your mask?" I mean, every conversation, she's making sure that I'm wearing my mask, right? But others don't, you know, and I've actually been in some friends outings that they are like, oh, what are you scared of? Take off your mask. You know, it's not that bad. What is COVID? It's nice and sunny, you know. So a lot of the education is there on the media part. But in terms of the physical, you know, you go to funeral and you are wearing a mask and people will be looking at you like, this guy too tight. You know, what is he scared of? You know, what is Corona? You know, and I think a lot of us too, I mean, Ghanaians in general have this mentality that COVID, you know, you can get COVID in Ghana, but it's not going to kill you, you know. But here again, we hear a lot of people die of COVID and all that. So I would say, you know, it's here and there. Some people do, some people don't. Yeah.
And
then you see a lot of Ghanaians that are wearing masks, but the mask only covers their mouth. and that's the part that I've really not been able to, you know, understood them. But you know, if you're wearing a mask, wear it to cover your mouth and nose, right? But a lot of them, they'll be wearing, even at church, you go, they'll be wearing it, but their nose is still open. You know, I guess they can't breathe, you know, well without the mask. So yeah, but that's yeah, the experience is a lot. You know, I just want to say that I'm really proud of the Ghanaian doctors and the nurses and everybody. You know, they spend the time to do what they could, but it's just that some of our Ghanaian population are so stubborn, they won't listen to. Is that that's how people end up getting this COVID. But if everybody is taking good care of, you know, themselves, it would have minimized, and that January wave would never have happened.
Yes, I agree. And I want to ask a couple questions about telemedicine. So we know that telemedicine has always been around. It's been around here for a long time, but we know that there's been a rise in telemedicine because a lot of people couldn't go to clinics and hospitals. We know there's a couple companies in Ghana that are trying to do more telemedicine. For someone who's been to Ghana and has been to a lot of healthcare systems, do you think that telemedicine is a good thing for the Ghanaian population? Do you think that it would help reduce some of the incidence of diseases in general?
You know what? It is a two-part answer to this question. Telemedicine, on its own, the idea is great. You know, the idea is great. You know, based on the fact that we did the same thing with money transactions and it worked. You know, we did. I remember when I used to send money to Ghana, I'll send it to a bank, and then my mom will go to the bank and collect the money. Now I can send it directly to to her phone. So she don't need to go to the bank to get the money. So it cut off the middleman, which is the bank. So it works. So, you know, that the tele one is also good. My only problem with that is that a lot of Ghanaians would not even be able to tell you whether they are feeling that their pressure is high or not. A lot of Ghanaians will never know whether their sugar level is going up or is high or too high. You understand what I'm saying? So sometimes the disadvantage that I see in the telemedicine is the fact that you have some underlying factors, and you have certain problem, and they really don't know much of your background. You know, when you go to the hospital, for example, they will pull your file, and they will see that 2020 you were here with high blood pressure issues, you were diabetic, you know, this day. So they have that record to be able to look and know exactly what to look at when you are. And trust me, myself included, a lot of us don't know too much about our health history, right? So with the telemedicine, it is good, but are you going to be, you know, believing everything that the person is telling you? Because I've seen a patient go to the hospital, and when they asked her how old she said she was 18. And she looks 60 something, right? So imagine if you are not seeing this person physically and you're on the phone and she's telling you she's 18 years, you believe her, right? So as much as I like telemedicine, I think it works more with people that are enlightened more people that are tech savvy and all that. But my personal experience, sometimes certain medications has to be given to you when the doctor already knows what you have, whether you are diabetic, whether you have high blood pressure, whatever you have, because some medicines can rather make your situation worse based on your condition. But the convenience of it is amazing. You know, you'll be home and you just get on your cell phone and you can get a doctor to talk to you within an hour or two. It's amazing. But my only problem is, do you know exactly what is wrong with you? You know, because when you be thinking that you have a headache based on something that you drank, maybe that headache is coming from your pressure, right? So, I mean, I'm not a health expert, so I'm just saying things I don't know, but I'm just thinking that as much as, you know, that idea is good, you know, we still need to encourage people to see doctors, you know, physically. Yeah.
Absolutely. And you say you're not a health expert, but, you know, Mr. President, you've done very, very well in explaining everything to everyone. And it's always nice to hear the realistic view of everyone. And what you said about telemedicine, I think is 100% correct. You need to know the whole picture. So if someone doesn't know their history, that makes it that much harder for the provider that's on the phone. And so to me, telemedicine is more like, it's a gap between like going to the emergency room, right? They would be able to identify maybe emergency things that would take you to the hospital. But you're right, if you don't know the whole history, it is a little bit difficult to be able to properly treat someone through telemedicine. But I think with the COVID-19, the way it was, I definitely think it provided a safe haven for people to prevent from getting the virus. And if it wasn't something that was too bad and could be treatable at home, we do also congratulate and really applaud all the doctors and nurses who are back home trying to, you know, help the telemedicine system to try to help our people back home. So definitely a very good initiative. We're going to go ahead and read some more of the comments on our feed. Let me just pull them up. And Mr. Producer, if you could help me pull some of the comments up. I'm sorry, I don't see on this end over here. And also, if you could let us know the phone number. Viewers, we do have a number that you can call if you'd like to join our conversation. If you have any comments or concerns and would like to join speaking with us today, if we could just have the number broadcasted on the screen, please feel free to give us a call. It's only going to be via WhatsApp because of the type of system that we're using. So go ahead and give us a phone call if you'd like to via WhatsApp only. And we'll be able to answer any of your questions, or if you wanted to give your own personal experience or have anything to chime in, we would love to hear from you. We're going to go ahead and take a quick break. When we come back, we'll see if anyone is on our WhatsApp call. If not, we'll go ahead and hear the president's final remarks, and we will close our show. Thank you once again for joining the Health Talk. Thank you.
Show me nade ninja la klana kuma mi ojogban benyele ake wagan biye ne no waje dane ko bagan bomode no yan shona no kweboni boleme yawo ke wona okomi fio shito fio keke na fio no wo ke mo lo e no yo dane ko jeje me hu e bomode no ya labadi no ya nani bi na fio e jeme we je no ko bibio ko gbe na ya Jamestown no ko ba na to le Chalewote Street Art Festival ni bi pie no ba anyo kase homo wo hu wo shiole wa denche wo bomode ko te no ayo homo wo hu e anu no pepule ko na pepule e bono onwonu o ye mase ke ko na mangbin e kra ngon fefe benyele ake gan bi ele wo le jojo gba jo ni wo ju owa ji palogo jo e ne kan jo le well Independence Day mba. One town wa Kenya fen ayiko.
Good afternoon, Yamime. Achomi nila telai, aka Sterling. Ye fane, meantime ab tanya adafifi oko. COVID ne bane, elako ni eba egbemewa. Ewo face mask na ke wo sani wo. Shi wana ake ka owo face mask ke chefio egbla otue, ehan otue se shambo. Ewo ehan ni mepi anya wo keche na mejio. Shi woke no kombajara na emi. Ni wo ba ho anye ne ba anye han owo face mask ke de lebi ka shi gbeke. Na eche yo tue ewo ni ene hu ake wo tue se. Ake mo kon se oku ese ne ba kan ne ke face mask ba blale ne ba mo miabo. Bo ba nyo wo le lebi ka shi gbeke. No jie ni onye una ila na eko ewo ene ni wo ke mbajara na emi na ele wo ba ho anye ko ta wholesale price aloba fan no ya ho wo ye habo ko ta no ba ji oba hele 11 wo ye habo wo number ni obanyo na wo ye no ne 0244 255 193 ko twa wo efe no yo obanyo wo ke ba no ba ho habo no wo fe wo ya jowo because ila gbonyo ni neba eba gbe wo san wo fe wo fo wo ya fa ba no onye yiwa don ketuebo.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us for another interesting episode of the Health Talks. On our comments here, we do have a comment from Mr. Efe Amayao, and he says, wow, impressive number of viewers. Thank you very much for your support. The phone number that you can WhatsApp if you'd like to join our conversation is 773-312-0318. Once again, 773-312-0318. You can contact us on that line via WhatsApp, and you would be able to join our conversation here. And today we are talking about healthcare in Ghana. Okay, we also see that we have a lot of people watching. We thank everyone who is tuned in. We see Mr. Johnny Woods, Miss Sophia, Miss Esther, Mr. Benjamin, Mr. Day, Axe Anthony, so many people that are here. We can't name you all, but we truly, truly appreciate you tuning in. We hope that this program was educational. We hope that you have learned something from it and something that you can also be able to share with your community. We are still talking with Mr. Kwasi Sam. He's been very wonderful today, giving us so much of information. So, Mr. President, is there anything you'd like to share with our viewers? Anything for your closing remarks? We'll get your closing remarks. And of course, if anyone wants to call in, we'll go ahead and take that. Otherwise, we'll go ahead and wrap it up for the evening. So thank you.
Yeah, thank you, Eunice. You've been great so far. And my comments, I mean, closing remarks, you know, whatever we call it, is that from my personal experience, we all need to take our health issues very serious. And you know, I remember very well when I was entering one of my friends' office building, and then there was this pharmacy shop. So I entered just to pick up some medication that I needed. And then I realized that you can do your
blood sugar
and your blood sugar check right there at the pharmacy. So just being there, I said, hey, let me just do mine too, because I saw somebody doing. And this attendant was a young girl of about 20, probably 24, 25. So when, you know, she checked my pressure, it was okay. Then when she pinched me to do my blood sugar, it was very high. And I remember very well, it was about 1 o'clock in the afternoon that day. And pretty much I hadn't eaten, but because I was hanging out with my friends, I had had a couple of Guinness, you know, and thinking that everything was okay. So she looked at my results and she looked at me and she's like, "Are you serious?" And I'm like, "What's wrong?" He said, "Your sugar is too high." You know, so that is where I realized that even though I was physically okay, there was nothing wrong with me, at least my system is telling me that my blood sugar was higher. Would I have known, if I didn't walk into that, pharmacy? I wouldn't have. And I continued drinking my Guinness, eating my fufu, my banku, and all that, increasing your sugar level, right? So I would say that we don't need to physically feel sick before we go to the hospital. I will advise that every single person should always make sure you know exactly what your medical history is. Even if your mom or your dad had high blood pressure, many years ago, you need to keep that at the back of your mind that you always need to check your high blood pressure every now and then. If you have a diabetic person in your family, you have to make it a point to always check your blood sugar. But in the whole, I think everybody needs to be conscious of their health. Without your health, you can do a lot of things. And when it comes to Ghana, there's a lot of deaths that I personally think could have been avoidable, based on the fact that people really don't check. I've seen a lot of people die of just high blood pressure just because they didn't even know they had it. So my advice to everybody watching this show is, especially those here in America, we have no reason not to check our medical, history. I talk to some people and say, "Oh, thank God I haven't been to the hospital for the last 6 years." I don't think it's advisable. Whether you are strong, whether you think you feel good, there's no reason to stay for 6 years without seeing a doctor. So my only advice to everybody is that let's take our health issues very seriously. The fact that you think you are physically okay doesn't mean you're okay. There may be something that is propping up that you never know. By the time you realize, it's too late. And when it comes to our folks in Ghana, since we talked about Ghana, I would say that the health system needs needs some progress. We need to fix a few things in the health system. And then there was one funny thing, I think I didn't mention it, but I'll mention it here. I was at a hospital and when I realized I was hungry, it was late. So the hospital kitchen had closed, right? So this nurse that was helping me out, a very nice guy that was helping me, I was like, "Oh, boss, I'm so sorry. The cafeteria is closed, but since you're hungry, can I get you something?" And I'm like, "Sure, if you don't mind." He said, "Yeah, give me money and I'll go out on the street to get you something to eat." And this guy is a qualified nurse. And I tell you, the options he gave me in terms of the food that he was going to buy for me sounded like somebody who does not know anything about healthcare. I mean, he was offering me, fried yam with tofu. He was offering me wache. He was offering me, and this, we're talking about 7 p.m. at night in the evening, and all the food. And I'm asking myself, is this guy a real nurse? Because which nurse, that will be taking care of a sick patient and be offering him yam and tofu when the person is seriously sick and on admission at the hospital? So all these things will need to, improve. When you're at the hospital, and I'm sure you know it already, that there's no food at the hospital that tastes that good.
Right.
Because hospital will always give you the most healthiest of all, but for Ghana, it's like, well, you are sick, but who cares? Food is different from whatever, but a lot of sickness we get through food. So I would just say that people in Ghana should just be cognizant of the healthy foods and the ones that are not healthy. I know you can eat foods that are not healthy here and there, but it shouldn't be consistent. And once you know your medical history, you will be able to, get along, easily. So, all in all, let's just take good care of our health. We need to live longer, and we need to be healthy. So let's including myself, let's all do our best to keep healthy.
Thank you very much, Mr. President. It's been a pleasure speaking with you today. If there's nobody on our WhatsApp call, I'll go ahead and just wrap up the program today. Today, we've talked about so many different issues, and it's been enlightening, and it's also been a call of action for all of us who are invested in our own country. So we know that there's been lots of efforts to enhance the disparities of healthcare access and improve health outcomes in Ghana. System-wide barriers have also impeded these healthcare deliveries, and they've exacerbated other problems, including quality and access to healthcare services still very much exists. But in order for us to address these barriers and optimize healthcare in Ghana, we need to take this at all levels, not only the government level. It needs to be something that is worked on with the Ghana Ministry of Health. It needs to be happening from regional and district level counterparts and providers in the public and private sectors, along with any donor agencies. When we do this, the development of delivery models will increase access and we will improve the health outcomes of our beloved country, Ghana. My name is Dr. Cromwell, and it's been a pleasure being with you this evening. Thank you once again for joining the Health Talks, and we will see you in 2 weeks. God bless you, and God bless our homeland, Ghana.
Hi, my name is Kwasi, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code, OKMD, and they will give you an amazing discount. Mobile doctors is my choice, and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile doctors.
Show me nade, ninja la, klana, come mi ojoban. Benye lake wagambiye, biye ne no waje. Dane ko bagan, bomode no yanshona, no kweboni boleme yawo. Ke wona o komi fio, shito fio keke na fio, no wake mo lo e no yo dane. Ko jeje me hu e, bomode no ya labadi. No ya nani bi na fio e jeme. We, je no ko bibio, ko gbena ya Jamestown. No ko ba na to le Chalewote Street Arts Festival. Nibi pie no ba anyo kase. Homo wo hu wo shiole wa denche. Wo bomode ko te no ayo homo wo hu e. Sanu no kwekule. Ko na kwekule e bono onwonu o ye mase. Ke ko na mangbin e kra nwo fefe. Benele ake gan bi ele wo le jojo gba. Jo ni wo jo wa ji palogo jo e ne kan jo le. Independence Day mba, one town wa Kenya fen ake, ayiko.
Good afternoon, Yamime. Achomi nila telai, aka Sterling. Yefane, meantime abtanye adafifi oko. COVID ne bane, elako ni eba egbemewa. Ewo face mask na ke wo sani wo. Shi wana ake o face mask ke chefio egbla otue, ehan otue se shambo. Ewo ehani mepi anya wo keche na mejio shi woke no kombajara na emi ni wo ba ho anye na ba anye han owo face mask ke de lebi ka shi gbeke na eche yo to ewo ni ene hu aka wo to ese akenmo kon se oku ese ne ba kan ne ke face mask ba blale ne ba momi abo bo ba anye wo le lebi ka shi gbeke no ji ni onye una ila na eko ewo ene ni wo ke mbajara na emi na ele Oba ho anye ko ta wholesale price aloba fan no ya ho wo ye habo ko ta no ba ji oba hele 11 wo ye habo wo number ni oba anyo na wo ye no ne 0244 255 193 ko twa wo efe no yo oba anyo wo ke ba no oba ho habo no wo fe wo ya jowo because ila gbonyo ni neighbor gbe wo wo san wo fe wo fo wo ya fa ba no onye you are don ketuebo.
The creator. Maka. Royal Black says the Abba. Maka. Entertainment and sports. Maka. I say politics. Maka. Royal Black says. Assembly Safwa. Bie assembly Puno. Sanepi adekami. Ekome ya kotofumi. Ekome ya misegbe. You want love fake hanye. Maka. Royal Black says the Abba. Maka. All the trending issues. Maka. I say politics. Maka. Entertainment and sports. Maka. RBJ the Abba. Where you full from cry. Asemi Safwa. Yeah, asemi Puno. Sa semna ba. Yeah, beka. Senya betino. Sapepe na beka no. Maka. Akesane kwedewo. Wabaye no ni wona je no na ke. Wabaye no ni wona je no na ke. Say your politics RBJ beka. Obeka. Hey sports RBJ beka. Obeka. Entertainment too RBJ beka. Obeka. Trending issues RBJ beka. Obeka. Maka yediaba yebeka. Maka yediaba yebeka. Royal Black says yaba yebeka. Royal Black says yaba yebeka. Assembly Safwa. Bie assembly Puno. Sanepi adekami. Ekome ya kotokumi. Ekome ya misegbe. You want love fake hanye. Maka. Royal Black says the Abba. Maka. All the trending issues. Maka. I say politics. Maka. Entertainment and sports. Maka.
Mama, I dedicate this song to you. Wherever you day, my mama, I just want to say thank you. Our mama, I just sing this song for you. Wherever you day, my mama, I just want to say thank you. For the things you they do for me, for the blessings you rain on me. Sometimes I lose my way, but you still the prayer for me, the sacrifice for me. Oh yeah, mama, God bless you, oh mama. Yeah, sure, oh mama, God bless you, oh mama. Hey mama, God bless you, oh mama. Yeah, sure, oh mama, God bless you, oh mama. Mama, you the first one. See the way you hustle for my kids. 9 months for the belly no be easy, but you endure the pain for my sake. One try me fake, woman yeah, mama woman yeah, woman yeah, you ain't in a woman yeah. Mama, God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. Hey mama, God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. For the things you they do for me, for the blessings you rain on me. Sometimes I lose my way, but you still the prayer for me, the sacrifice for me. Oh yeah, mama. Bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama.
I dedicate this song to all the women in the world, especially my mom. Amaino, God bless you.
Hallelujah.
eventually, finally, everything is working for me. Finally, finally, cause I got the favor of God over me, over me. Everything is working for me. Finally, finally, cause I got the favor of God over me, over me. Though I don't deserve, oh yo yo, it's working in my favor. Ay ay ay. Though I don't deserve, oh yo yo, it's working in my favor. Ay ay ay. If I say I have to calculate to you or speculate to you, His promises don't fluctuate to you or palpitate to you. His blessings just be flowing out, down on me. His favor just be flowing out, down on me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where He favor me, favor me, favor me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where He favor me, favor me, favor me. Everything is working for me. Finally, finally, cause I got the favor of God over me, over me. Everything is working for me. Finally, finally, cause I got the favor of God over me, over me. Though I don't deserve, oh yo yo, it's working in my favor. Ay ay ay. Though I don't deserve, oh yo yo, it's working in my favor. Ay ay ay. So as you see me dancing, favor, amen. I dey count my money, oh, favor, amen. As I dey drive Bugatti, favor, amen. When the song hit you, favor, amen. Let me hear your amen, oh, amen, 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 amen. Say your amen, 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 amen. Though I don't deserve, oh yo yo, it's working in my favor. Ay ay ay. Everything is working for me. Finally, finally, cause I got the favor of God over me, over me. Everything is working for me. Finally, finally, cause I got the favor of God over me, over me.
It's magical.
Mama, I dedicate this song to you. Wherever you day, my mama, I just want to say thank you. Our mama, I just sing this song for you. Wherever you day, my mama, I just want to say thank you. For the things you they do for me, for the blessings you rain on me. Sometimes I lose my way, but you still the prayer for me, the sacrifice for me. Oh yeah, yeah, mama. God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. Mama, hey mama. God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. Mama, you the first one. See the way you hustle for my kids. 9 months for the belly no be easy, but you endure the pain for my sake. One try me fake, woman yeah, mama woman yeah, woman yeah, you ain't in a woman yeah. Mama, God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. Mama, hey mama, God bless you, oh mama. Yeah, me sure, oh mama. God bless you, oh mama. For the things you they do for me, for the blessings you rain on me. Sometimes I lose my way, but you still the prayer for me, the sacrifice for me. Oh yeah, yeah, mama, mama, mama.
Everything is working for me, finally, finally. Cause I got the favor of God over me, over me. Everything is working for me, finally, finally. Cause I got the favor of God over me, over me. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. If I say I have to calculate to you or speculate to you, His promises don't fluctuate to you or palpitate to you. His blessings just be flowing out, down on me. His favor just be flowing out, down on me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where you favor me, favor me, favor me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where you favor me, favor me, favor me. Everything is working for me, finally, finally. Cause I got the favor of God over me, over me. Everything is working for me, finally, finally. Cause I got the favor of God over me, over me. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. So as you see me dancing, favor, amen. I dey count my money, oh, favor, amen. As I dey drive Bugatti, favor, amen. When the song hit you, favor, amen. Let me hear your amen, oh, amen, 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 amen. Say your amen, 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 amen. Though I don't deserve, oh yo yo, it's working in my favor, ay ay ay. Everything is working for me, finally, finally. Cause I got the favor of God over me, over me. Everything is working for me, finally, finally. Cause I got the favor of God over me, over me.
It's magical.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, emceeing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1 773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
The creator.
maka maka. Royal Black says the Abba, maka maka. Entertainment and sports, oh, maka maka. I say politics, maka maka. Royal Black says, Assembly Safwa, Bia Assembly Puno, Sanepi Adekami, Ekome ya Kotofumi, Ekome ya Misegbe, you want love fake hanging, maka maka. Royal Black says the Abba, maka maka. All the trending issues, maka maka. I say politics, maka maka. Entertainment and sports, oh, maka maka. RBJ Diaba, where you full from cry. Asemi Safwa, yeah, Asemi Puno. Sasemina ba, yeah, dear, yeah, Becca. Senya Betino, Sapepe na Yebekano. Maka maka, Akasane Kwetewo. What by you no ni one je no na ke. What by you no ni one je no na ke. Say your politics are RBJ Becca or Becca. A sports are RBJ Becca or Becca. Entertainment to her RBJ Becca or Becca. Trending issues RBJ Becca or Becca. Maka maka ya diaba o ya Becca. Maka maka ya diaba o ya Becca. Royal Black says diaba o ya Becca. Royal Black says diaba o ya Becca. Assembly Safwa, Bia Assembly Puno, Sanepi Adekami, Ekome ya Kotokumi, Ekome ya Misegbe, you want love fake hanging, maka maka. Royal Black says diaba, maka maka. All the trending issues, maka maka. I say politics, maka maka. Entertainment and sports, oh, maka maka. Maka maka. Maka maka.